through some basics to do with collars now, okay? So this is the front of the collar. This part sits on the patient's sternum. The patient's chin sits in this part. Okay, you have to make sure that the breastplate is flat to the patient's chest. You can also check that you've got the collar up the right way, because here, if you look, there is an up arrow, and it also says that this is the front of the collar here. Okay, this is the back of the collar. You know it is the back of the collar because it has the word back on it at the bottom here, and it's also important to make sure that you have this up the right way, which can be difficult sometimes, so make sure that you follow the arrows pointing upwards as well. Be mindful here, because the collars have they're plastic and they're hard. Okay, so this can cause pressure areas. So always make sure that the padding is covering the pointed bits on the plastic here. The middle bit here is where the patient, if they've got a tracheostomy, that's where the trachea will sit. This is an ocean back. So this is to be worn when the patient is in bed. If you get the patient out in the chair, they have to wear the regular back part of the collar, which is this part. Okay, again, you have the up arrows here. All right, so make sure you get this up the right way. And also make sure you pop it far enough down the patient's back as well. One size fits for this. So what you are to do is you use this back and you use the front of the collar, which is fitted for the patient.
So this is a Miami J collar, which is a hard collar. So obviously made out of hard material, hard plastic. Hence, this is why they have pads to protect the patient. We have lots of little sharp areas here that, if left uncovered, can cause pressure ulcers for the patients. So you can get pressure ulcers at the front, you can get pressure ulcers at the sides, you can get pressure ulcers here if this is not fitting correctly, and also at the back. Wherever this collar is not covered by a pad, your patient is at risk of a pressure ulcer.
It's really important that the patients are fitted with a correctly fitting collar. Okay, so we're going to run through some checks to help you fit a collar correctly. The first thing you can do is if you place some fingers here, so you basically look here and the number of fingers you have over the width of someone's neck, and then you come across and you see if they correlate here. So I can see that Pam is a regular size collar. As you can see, there are lots of different collars here. So if Pam is a regular here, and another standard collar that can be used in men is sometimes a short collar, it is important to know that one size doesn't fit all. So you may end up using, for example, a short front and a stout back in order to get the best fit. If you're ever unsure on how to fit a collar, you can either speak to the spinal nurses or you can speak to the physios, and they will help you to fit a collar correctly. So we're going to fit Pam with a collar. Alright, so we've measured in a previous video, so we know that the regular fits Pam the best. So what we're going to do is we are going to scoop and place the collar in. So it's a scoop and lift as you settle the collar in. Don't just place the collar on, because that's going to give you a gap. So scoop and lift and place there. And then I'm going to put the back of the collar on. I'm going to make sure that the arrows are facing up the right way. And the pockets on here. Normally you do have a friend to help you. So here. So now that we've fitted Pam with the collar, you need to check that it's fitted correctly. So you need to check that it's sitting below her ears, here, it's sitting comfortably on her shoulders, and all the plastic areas are covered. So there's a bit here that I can see isn't, so I'm just going to bring that around and cover that. That it's sitting flat to her chest here, and that the chin, that you have about 1.5 centimetres of lip on the padding, and it's all covered. So I can see that it's all covered. And then looking round at the back, Is it far enough down her back, here? And is it digging into the top of her head? Okay. It's also important to make sure that the Velcro parts on this collar are equal, and if you need to check for alignment, you need to look down from the patient's nose to the chest and make sure that that is all straight and in alignment.
So for washing the pads that come with a Miami J, you can put these in a bowl of hot water with some Hibi scrub mixed together, and just make sure it's clean of any debris that you can see. And then once you've washed and rinsed them, dry them around the patient's bed space. I put them on a towel or some hand wipes if you have them, and just make sure they're allowed to air and they're correctly dry until for them to go back on the patient. And then for the ocean back, you have to be very mindful of moisture lesions because there isn't anything there to collect any moisture, it just sits on top of it. So you have to then change that, wipe it with a Clini wipe, make sure it's dry and free of debris before you reapply.